I'm Steve Sunderland, the director of the Cancer Justice Network, and I'm sitting with Robert Harris, who's over here. Robert is a longtime friend and the chair of the board of the Cancer Justice Network. So our dream was to bring people from dinners that they went to, homeless people, poor people, people with disabilities, senior citizens, have a chance for them to have dinner, but also to hear about health, to hear that they have the right to full health care, and they have a right to get cancer exams. So then we would take them to a clinic for a free cancer exam, and if it turned out they had cancer, we would take them with navigators, we call ourselves, to a hospital where they'd get their treatment, and then after that, we would take them to survival groups. That was our dream. Our dream was that we could build a brand new roadmap for justice in our city, and that we could bring that roadmap into every hospital and every different part of the city through transportation, through navigators, and through better treatment. So we moved from this dream to the reality where we are right now. We have organizations that we're with every day of the week except for Sunday, where people come for their dinners, they come for support. We talk to them about their health. We tell them they have the right to full health, and we then take them for screening to lots of different agencies, for screening for general health, screening for heart disease, screening for diabetes, and cancer. We're very interested in cancer because we're the cancer capital of Ohio here in Cincinnati. So we want to cut into that mortality rate. So we want to bring them for screenings, and then we want to bring them to agencies for treatment. And we've been able to do that. We've been really successful in that area. So we've now opened up a brand new model, thanks to your support, of a citywide and a countywide effort to bring justice to healthcare. So one of the key areas that we worked with is in the area of transportation. How do we get people to healthcare who can't afford the transportation that exists? So we've turned to Robert Harris, who's on the board of our transportation agency, and it also is on the board of our disabilities agency in town, to help us figure that out. Robert, how have you done that for us?
Well, I don't say I have succeeded, but we are succeeding. Because with your money and with your efforts and with the OKI and other people helping us, we have identified and we have received and we are using vehicles that are wheelchair accessible, as well as accessible to people who can walk and who are ambulatory. But with your help and with the organizations that we're working with who have the transportation available to us, we are able to help these folks get the treatment that they need, get the help that they need, and truly become part of this human family that we all know that we need to take care of.
So we are now going into that next stage of building a commission on health inequities in Cincinnati. We are putting this into practice, and we say we want to expand. We want to bring consciousness to the community about justice in healthcare. And we're doing this in a lot of different kinds of ways. We're doing it by having meetings. We're doing it by publishing materials. We're doing it by using the arts. Now, Robert is a world-class gifted artist, and he has designed a series of paintings that we're now going to be using throughout the city to bring consciousness to people about healthcare. Let's look at one of Robert's paintings if we can. But this is a woman, as you can see, who has something to say to us, and we want this person to say it to every community in our city itself.
Well, no one should be deprived of services and they die, because no one should have that stamp put on them that they are poor and undeserving.
Thank you, Robert. Very well said. And we look forward to more relationships with you and with the Congregation of St. Joseph and with all of the agencies that support us in this effort. We are in this community together, one family, for justice, for health care for everybody. Thank you very much.
Thank
you, Robert.
Thank you, Steve.